Hello, everyone, and welcome to the EMDR Maven podcast. I'm Julie Miller. I'm an EMDRIA-approved basic and advanced EMDR trainer, an EMDR Institute regional trainer, an EMDRIA-approved consultant, and certified EMDR therapist. I provide training through the EMDR Development Center, and you can learn more about that at the website, emdrdevelopment.com. This is Season 2 of the EMDR Maven podcast. We're going to be discussing the use of EMDR therapy in the treatment of addictions, including substance addiction and behavioral compulsivities. I often present on the use of EMDR with addictions, and so there's other trainings available. There's a training with the EMDR Institute coming up in August, and I have a training on my website. There's lots of information out there about the use of EMDR therapy with addictions, and I really want to help folks learn how to use EMDR with addictions and be available for questions and consultation to help us get EMDR out there improving people's lives who are struggling with compulsivities and addictions. If you have questions about any issues related to EMDR and addiction, please send them my way. I'll be happy to answer them here on the podcast. I host an EMDR no-fee study group on the last Wednesday of each month, except for December, through Zoom from 12 noon to 12:50 Arizona time. This group is for anyone who has completed the EMDR basic training. Just send me an email and I'll be glad to send you the link. You can email me at jmiller4721@gmail.com. That's jmiller4721@gmail.com. The first topic for today's podcast is about addiction and EMDR therapy. What are we doing with treatment for addiction and compulsivities? With the addiction issue continuing to grow, the death rates in North America continuing to escalate, why are we not using EMDR in our treatment programs? Now, when I say addiction, I mean both substance use disorders and compulsive behaviors. And I know there are many residential and other kinds of treatment programs that are using EMDR as part of their treatment, but they tend to focus more on trauma and not so much on stabilizing the addiction before addressing trauma. So according to NIDA, the National Institute on Drug Abuse, in 2024, they published statistics saying that in the year 2020, 40 million people in the United States had a substance use disorder, and that does not include behavioral addictions. That was about 11% of the population. 40 million people in the United States have substance use disorders alone. That's not compulsivities. And also in 2020, only about 6.5% of that 40 million received treatment for the addiction. And in our country, the highest rates of fatal overdose tends to be among Black and American Indian, Alaska Native people. This is not a problem that's going away anytime soon, and it affects a tremendous number of people in our communities. We have to find a way to make treatment more effective. Now, we also know that many, up to 92% of those who are experiencing addictions have a history of unresolved trauma or adversity. So when I first started out working in the mental health field, I worked in addiction. That had been my goal for many years. And we always used to say, if you scratch a substance use client or an addiction client, you scratch underneath, you'll find trauma. Well, that's true of up to 92% of the folks that have addiction issues. And so we know that that requires treatment of each issue at the same time, right? Dual diagnosis, comorbidities require treatment concurrently of each issue. So addiction and trauma has to be treated at the same time. Just as addiction and depression, which you could also translate as trauma, or addiction and anxiety, or addiction and relationship issues, those all have to be dealt with. And you can't deal with one and then expect that they're going to stay sober long enough to treat the other issues. We have to do them at the same time. So EMDR therapy, we know, is validated for treatment of unresolved trauma. And there are also appropriate addiction-focused protocols. And these have been researched and found to be effective. They're not recommended as a comprehensive treatment to stand alone to help someone get sober or abstain from behaviors that are problematic for them. We know that, however, it can help stabilize addiction and keep someone in treatment longer, which improves their chances. The addiction-focused protocols stabilize the addiction and can allow for a titration of trauma to get processed. Some of the concerns about the use of EMDR therapy with addiction clients is just simply that it's going to be too much for them and they're going to relapse when they're doing EMDR therapy on trauma. But the reality is there are other ways to use EMDR therapy in addition to trauma work. We don't have to just jump right into trauma work with an addiction client who's come to an outpatient program, come into your office for outpatient therapy. They're in a residential or an inpatient treatment facility. We can start with addiction-focused protocols that allow the client to stabilize, to reduce cravings, to reduce reactivity to triggers, and then we can work in some of the trauma work to help them stay abstinent as they're going through the treatment program and afterwards. So there is, in some circles, interestingly, which I actually don't completely understand, a lack of acceptance of EMDR therapy being done concurrently with substance use treatment or with compulsivity treatment. I think this may be a sort of holdover from early in the existence of EMDR therapy, when it was the treatment model. EMDR therapy was kind of discounted. It was just too weird. Waving your fingers in front of someone's face. People discounted the research. They continued to discount the research in certain circles. I can say that in the Veterans Administration Hospital in Southern Arizona, where I live, the use of EMDR therapy has been growing. And more people have gotten trained in EMDR therapy there, but for many years, it was not recommended. People were not allowed to use it. It was frowned on, which I never understood. I think that's changing. There are outpatient treatment programs in my area that also will not use EMDR therapy with their clients as they're going through a 12-week or longer treatment program for addictions. Again, I don't understand that. The only reason I've ever been given is that you can't bill for EMDR. And if that's something you've been told or you think yourself, I just want to really challenge you. It is not something that is billed for separately. I bill insurance companies because I'm in private practice in Tucson, and I do EMDR every day, all day long. I'm not telling them what modality of treatment I'm using. I'm billing for the time that I spend with that client. And if I'm with the patient and their family, or if I'm doing teletherapy, don't understand the resistance to using EMDR therapy in treatment programs. It's not necessary to treat trauma only with EMDR therapy. And that's what I think is important, is that we increase the client's odds of staying in treatment, so they can stay longer. They don't go AMA quite as quickly. And also it increases the likelihood that they'll stay abstinent, clean and sober longer. So I think it's important that we be aware of that and encourage people. If you're working in a facility where you're doing treatment for compulsivities of some kind, either substance use disorders or other kinds of compulsivities like gambling, like sex addiction, like compulsive spending, or other behavioral or process addictions, EMDR therapy should be part of that program. So we're going to talk about some of those myths in season 2 of this podcast, and hopefully educate both listeners, those of you who are interested in learning more about this, and also educating other providers and other treatment programs where perhaps EMDR is not used to stabilize the addiction or is not accepted as a validated form of therapy. Of course it is. We know that. It's been validated with over 40 randomized controlled trials since the first one published in 1989. Research studies that meet all the criteria for excellent research. So the whole idea that has been going on and passed around out there that EMDR is not validated with research or the research is not good research has completely been debunked. And it just means that people haven't stayed up with research on EMDR therapy. They hear something and then they just dismiss EMDR therapy. And so we need to be out there talking about the research base for EMDR therapy, what we know works, and how we can help people to improve their treatment experience and their outcomes. So thanks for listening to my soapbox rant. I think it's just so important. And I want to make sure that we've got it available to help people who really want to get better and change their lives. So in this season, we're going to be talking about all things addiction related that are going to be helpful for folks using EMDR therapy in the treatment of addictions. We are going to talk about things like the potential causes of addiction, which influences how we treat or use the standard protocol and addiction-focused protocols, some of the standalone versus comprehensive treatment ideas, how we can integrate EMDR therapy into treatment programs. I do want to review the research on EMDR and the treatment of addictions, including those addiction-focused protocols like the Detour protocol, the feeling state addiction protocol, the CRAVE-X protocol, and the uses of group therapy. We want to address some of those challenges we have with clients, which includes affect phobia, alexithymia, suicide risk, how we can integrate ego state work and IFS into addiction treatment, and how we can integrate EMDR therapy into the groups that are so often used for treating addiction. And I think it's a tremendous form of treatment, especially with addiction and compulsivities, to use group therapy, but now we know how to integrate EMDR therapy into groups, and it can be incredibly powerful. We're talking about a shift in our attitude about the use of EMDR therapy in comprehensive treatment of addiction. So please follow along with me. This will be every couple of weeks. We'll have a new podcast episode, and I'm hoping to have some really great guests who are going to talk about their work with EMDR and addiction. So again, if you have any questions, please feel free to send them my way. We'll make sure that we get those addressed. And you can send any questions to jmiller4721@gmail.com. So thanks for listening, and everybody have a great day. We'll talk to you soon. Bye-bye.